The Alberta Children's Hospital is operating at over 120%, Mr. Speaker. Children's hospital staff are being overwhelmed, and as emergency rooms fill up, families are forced to wait outside in trailers to get the care they need. Imagine that, Mr. Speaker. This government points fingers at everyone else and letting Premier Smith do whatever she wants to our public healthcare system. Canadians are fed up being told that it's someone else's problem. When will this government do its job and uphold the Canada Health Act?
The Honourable Minister of Health, or Mental Health.
Mr. Speaker, the Canada Health Act is one of the most important emblems of our country and the access to publicly funded quality health care. It is extraordinarily important that we all do our part to help all of the pediatric institutions by doing what has been asked by public health, washing our hands, keep a distance, wear a mask when you're in crowded indoor spaces, and for us to be able to work with provinces and territories on the health human resources crisis and on the adequate funding as we go forward.
The Honourable Member for London Fanshawe.
Well, that answer was not enough from this minister. There is an influx of sick kids in Ontario, and parents are panicked. Canada's healthcare system is in a state of crisis this Prime Minister can't ignore any longer. CHEO is calling in the Red Cross to help. Kingston Health Sciences is taking kids from Hamilton and London as their children's hospitals are overrun and understaffed. Conservative premiers are gutting healthcare, and this government is allowing it to happen. What will it take for this government to finally sit down with the provinces and provide the funding needed so sick kids can get the care they need?
Hear, hear, hear.
The Honourable Minister.
Mr. Speaker, we are worried, as are the parents of kids across this country, and our hearts are with them, but we all have to do everything we can do to keep people well and to observe the public health measures by the public health authorities. Our government has a long track record of working with provinces and territories not only to provide the funding, but to ensure the national vision for health care that delivers for Canadians. Our government has made significant investments to support health systems, $72 billion over the course of the pandemic. We will increase the Canada Health Transfer by 10% in March, as we increased it by 5%.
The Honourable Member for Whitby.
Mr. Speaker, we know that persons with disabilities are disproportionately